Is everyone ready to go? Are we sure?
Okay.
Stand by, please. Going live in three, two, one.
Start the clock.
Q and out.
Live from the Health Sciences District, we welcome you to our studios at University Health, Kansas City's Essential Hospital. Now here's Keith King.
An underdog keeps a contender from scoring in Kansas City. Ecuador squares off against Curacao in World Cup excitement, and we are here to talk about it this morning. Good morning, everyone. I'm Keith King with University Health, and welcome to Healthy Goals, our live YouTube show where our providers talk about World Cup soccer, the wins, the losses, the bumps, and the bruises after each matchup. Joining me live this morning in our studio is University Health Executive Chief Clinical Officer, Dr. Mark Steele. He is the top doctor here at University Health. He also played soccer in college and continues to be a big soccer fan. Also joining us in just a few moments is Dr. Christopher Shaw. He is a University Health orthopedic surgeon who specializes in sports medicine. He's also a team doctor with Sporting KC Soccer. Coming up, we will break down what was predicted to be one of the more entertaining matches in Kansas City. Ecuador is one of the toughest teams in South America to score against. Curacao making its first ever World Cup appearance, hoping for a Cinderella ending. They got one, kind of. We will ask our experts for their key takeaways on last weekend's match. Also, as I mentioned, Dr. Shaw is an orthopedic surgeon who specializes in treating athletes. We will discuss common soccer injuries. All this soccer talk may be motivating you to get moving, to exercise more. We will have tips on how to stay active while we age. Plus, the soccer matches and Fan Fest bring in large groups of soccer fans together in one space. Big crowds can be intimidating, even scary for some people. A University Health behavioral health expert will give us useful tips on how to navigate large crowds. Finally, meet the University Health physical therapist who used her soccer skills to find a career helping and healing others. That story is just ahead. If you're a member of the media or you are watching us live this morning, we want to hear from you. Email us your questions at publicrelations@uhkc.org. Again, publicrelations@uhkc.org. Email us your questions and be part of the conversation this morning. All right, let's get started. Let's bring in Dr. Steele. Big weekend, again, Ecuador, Curacao. That was Saturday night's match here in Kansas City. I think it was kind of a David and Goliath type story, and David ended up doing okay. Dr. Steele, what's your take on it?
Yeah, absolutely, Keith. No question about that. Obviously, Curacao turned in a gritty performance, and really, hats off to Eloy Room, their goalie, who made 15 saves, which was just one save short of the World Cup record that's actually held by Tim Howard, a U.S. goalkeeper from the past, and earned their first point in the World Cup. So it was a big day for Curacao and probably a frustrating day for the Ecuador side, who had a lot of opportunities.
So there were really no injuries to speak of. I mean, was there anything that stood out to you that kind of made you think that can't be good?
Yeah, I mean, there was one instance where I think a couple players collided slightly, and one player was down on the ground for just a few seconds, but then got up and apparently had no long lasting injury from that.
Yeah, that's a good thing. So, but as we kind of broaden it out to looking at the World Cup matches, last Thursday, a midfielder for Canada ended up breaking his leg after a tackle. That match against Qatar, and a key player with the U.S. team missed last Friday's match against Australia due to a calf injury. The U.S. went on to win that match, luckily. What are your thoughts about those two types of injuries? One seems very serious. The player will not be back for the broken leg, obviously. But what are your thoughts on it?
Yeah, well, I mean, obviously, soccer is a contact sport, and so injuries do occur. Unfortunately, for the Canadian player, broke his lower leg, and so obviously will not be returning. And then you alluded to our U.S. player, Captain America, Christian Pulisic, who is clearly the best player on our side, had to sit out this last game. Does have a calf injury. It's a little unclear whether he has just a bad calf bruise or maybe pulled a muscle in his calf.
Let's talk a little bit about our emergency department. Again, we have been planning here at University Health for large crowds. Where we are located is just a few blocks away from FanFest and from Power and Light. We had a big weekend at FanFest. Are we seeing folks arrive here at the emergency department? And if so, what are they being treated for?
Yeah, we're seeing a few patients, actually, relatively few. We didn't have anybody that we saw on Friday, and then over the weekend, I think one patient on Saturday and three that came in yesterday. Don't know the details of all the patients. I do know that one of the patients had appendicitis, which is something that can happen to folks, obviously, and so that had to be managed in the usual fashion.
We have been receiving some questions from our friends in the media. Let me ask you a couple from reporter Kathy Quinn with Fox 4 News. Her question is: what are the symptoms of heat exhaustion and how is heat stroke different?
Yeah, so heat exhaustion is a milder form of heat related illness, and then heat stroke is an extremely is on the other extreme, is a life threatening condition that people have to be taken care of immediately. With heat exhaustion, when an individual is out into the heat, a lot of times these folks will be sweating quite a bit, and then they just start to feel bad. They may feel a little bit weak, get a little lightheaded. Sometimes individuals will have some nausea or even a headache. And so if you start to experience those kind of symptoms, obviously the treatment for that is to get them out of the heat, get them into a cool environment, and then typically fluids, either oral or IV fluids, help in that instance. Heat stroke, on the other side, is life threatening. These individuals are the hallmark of heat stroke is that people end up having some type of mental status change. So they may start to become confused, lethargic, may even become unresponsive, and then have very high temperatures, typically 104 degrees Fahrenheit or higher. Their skin typically is warm and hot. They actually stop sweating in that instance most classically.
Okay. And does heat stroke present differently in children?
It presents fairly similarly, although children, when they start to have symptoms, they may initially display irritability, restlessness, may have some trouble finding their words, but then also can become lethargic and even unresponsive in extreme cases. And obviously, with heat stroke, you need to get them to care immediately, and then obviously want to cool them down as quickly as possible. And in this instance, for adults, we're using the bags filled with ice and ice water to cool them off.
Which we've been talking a lot over the past couple
Yeah.
of weeks in our preparedness here at University Health. Finally, one more follow up question from Kathy Quinn with Fox 4 News. What sorts of medications make someone more susceptible to heat exhaustion?
Yeah, that's a good question. So the body, the way it most common, or the way that we dissipate heat the most is by sweating. And so there are some medications that actually impair sweating. And some of those medications include some blood pressure or cardiac or heart medications. Also, antihistamines can reduce the ability to sweat. Some of our behavioral health medicines, including some antidepressants, can also fall into that category. You also have people who are on diuretics, which could lead to a little bit of mild dehydration that could predispose one to heat exhaustion. And then also, there are individuals that occasionally are on stimulant type medications, for instance, those who get treated for ADHD, and those can increase the body's production of heat, and then once again might potentially predispose one to heat illness.
So, a wide variety of medications, then
Wide variety.
obviously.
Yep.
Okay. All right. We have a couple more questions. This one comes from KCTV5's Betsy Webster. Have you been seeing an increase in sprains or related injuries with the big crowds at FanFest and Power and Light during the World Cup?
Yeah, I can't say that we have personally seen that, although one would anticipate injuries. Anytime you have a lot of people and large crowds, and there's obviously the ability or the possibility of someone tripping, falling, stepping off a curb, spraining an ankle, those kind of things. But I can't speak. We personally are here at University Health have not seen a lot of that.
That's obviously good news.
Right.
And you have also been you've experienced FanFest yourself.
Yes, yeah, I have been there twice. Went to both of the U.S. matches. Was there on Friday. Large crowds, very energetic, a lot of passion in the crowd, and obviously good results in both instances. So very happy about that.
Do you have any advice for someone who's thinking or who's going down to FanFest? Anything about, we keep hearing go early. If you're planning on going, make sure that you go early.
Yeah, I
Anything?
would definitely go early. Actually, the first game, which a week ago Friday in the evening, we didn't have any delays getting into the game. This past Friday, though, pretty long line to get in. Took us about an hour total to get there, and so definitely would go early. Obviously, want to come prepared. Especially if it's warm outside. Fortunately, our weather has not been super hot, so that's been good. But obviously, staying well hydrated and wearing light colored, loose fitting clothes to help keep you cool. And obviously at the fest, there are some areas where you can get in the shade and get out of the sun, which is helpful.
Right, great. I want to ask one more question from KCTV5's Betsy Webster regarding injuries. What are the top causes of sprains or related injuries among the general populations, not pro athletes?
Yeah, I think the more common sprains, I mean, obviously ankle sprains are probably the most common sprain. Individuals can have muscle sprains or strains from various activities, including, but most commonly in the lower extremities, so either your calf or in your thigh. If you're doing any kind of activity where you're running, accelerating, lunging, those kind of things could result in a muscular type strain.
Okay. All right. Dr. Steele, thank you for your input, your expertise. Stay with us for just a couple more minutes. I've got more questions to ask you here in just a little bit. Meanwhile, of course, soccer and injuries go hand in hand. No doubt it is a tough sport that often requires physical therapy for recovery. One University Health physical therapist is using her soccer experience to help patients heal from their injuries. Take a look.
Slide this along the knees. My name's Paige Valaika, and I am a physical therapist here at University Health. I started playing soccer when I was 5 and played competitively until I was about 22. I grew up with it, like it was a huge part of my life. Like one of those things, we all have those things where it's like, oh, kind of feel like a kid again. Played high school soccer, and then after high school soccer, I knew I just wasn't ready to be done, and so I continued on and played Division II at Rockhurst University. Any soccer idols growing up on the guys' side, there's your big ones, David Beckham, Ronaldo, Ronaldinho, still Leo Messi, obviously, all those big ones. And getting older, like Marta was a big one, Rainey Chastain, Mia Hamm, obviously. Just do 2 more. I always kind of knew I wanted to do something more medical. I started looking at schools that had also physical therapy programs or pre-physical therapy programs, and I kind of landed on Rockhurst. And so I did undergrad at Rockhurst, played soccer during undergrad for all my years of eligibility, and then was able to transition into the doctorate of physical therapy program there. Do the same thing down and back one more time. I think it's helped a lot, especially with the athletes, because I've done it, like I know exactly what it is we're asking them to go back to do. I feel like being an athlete myself, like I know exactly what we really need to be prepared for. And so I think that helps with getting them prepared and ready to go back without getting re-injured.
She knows how most people are and doesn't try to push it too much, but just tries to keep you on a healthy path and not re-injure yourself sort of path.
I'm very excited for the World Cup, especially to be in a host city. Not only is it just like the one game, or if you had to travel for the one game, but it's gonna be here the whole summer. Sometimes I get sad, and then I remember I have World Cup tickets and I'm not sad anymore. It'll be an amazing experience. I'm very excited.
All right, welcome back, everyone. And joining us live this morning in our studio is Dr. Christopher Shaw, who is a University Health orthopedic surgeon. Also, you are a team doctor with Sporting KC. Tell me a little bit about your role, first of all, with Sporting KC.
I'm one of the orthopedists. We have several orthopedists on a panel that cover the team. So we cover all the games and do player intake and evaluations as well as exit physicals and things like that, taking care of the team.
So during a match, kind of describe, set the scene. Where are you? What are you looking for? What kind of causes concern for you?
Absolutely. So during a match, we're there mostly as fans. Hopefully, our goal is that they don't need us at all. One of us will sit on the bench, typically the head team physician, Dr. McCullough, and then I'm usually standing behind Sporting's bench in case they need me.
Hmm. Uh, eh, eh, Question to you, just in general with World Cup. I mean, how this is what you do day in and day out, but it's probably fun to watch this as a fan, I would imagine.
Oh, I grew up playing since I was 5 years old, so for a long time it was kind of the air that I breathe. So yeah, the World Cup is one of my favorite times. Every 4 years, we get to see all the best teams on a world stage, and to have it here this year, it's so exciting.
Yeah, yeah. So, Dr. Steele and I talked just a few moments ago, there was nothing injury-wise that really happened during Saturday's match,
Mhm.
luckily. However, when we kind of widen out and look at some of the other matches, last Thursday, a midfielder with Canada ended up breaking his leg after a tackle.
A very
That
severe injury.
that match against Qatar. Talk to me a little bit about an injury like that. From what I understand, he's out obviously for the rest of the tournament.
Yeah, he'll likely need surgery to realign and then stabilize the tibia. Occasionally, you have to stabilize the smaller bone, the fibula, as well. But very often, we have to rod or put a nail inside the tibia.
Mm.
Um, he'll get up and be walking right away, but that bone will take at least 3 months to heal. So it's definitely a tournament and season ender for that athlete.
Mhm. Another key player with the U.S. team ended up missing last Friday's match against Australia due to a calf injury. How common are injuries like that?
At this level, these athletes they're so strong and so well trained that um, it's actually pretty high incidence of soft tissue injury like this, whether it be a calf pull or a hamstring injury that can be sometimes they'll miss several weeks, sometimes maybe just a game. So hopefully for Mr. Pulisic, we get him back by Thursday,
Yeah.
or at least by the elimination rounds where we really need him.
Okay. A common injury in soccer is to the ACLU. This is something that you are very familiar with, treating with a lot of your patients. Go ahead and explain this type of injury.
The ACL is one of the major stabilizing ligaments in your knee. There's four, and it's one of the most commonly injured. It's the most commonly injured that is requiring of surgery. Most ACL injuries, if it's a complete tear, require surgery to get back on the field and get back to the level of play that they were at prior to their injury.
Talk to me a little bit about the symptoms when someone is suffering from this injury.
Very commonly, and most commonly, it's a non-contact injury. So you'll actually see the players running down the field. They'll twist their knee. They'll likely describe to us that they felt a pop. And then over the next couple of days, they'll have a significant amount of swelling in the knee called an effusion. And they'll feel the player or the patient will tell you that their knee just doesn't feel stable. They can't trust it. And then there's some physical exam findings that we can do right there on the field to ascertain whether or not they have an ACL injury that are very, very sensitive and specific for an ACL injury.
Is the type of injury different for men compared to women, or is it more common in one or the other?
The injury itself is not different. It's still the same ligament. We do see, unfortunately, a higher incidence of ACL tear in female athletes. Um, just there's some things that make them predisposed at a slightly higher risk than male athletes, but it does happen at a high level in high level athletes um, at an unfortunately a significant rate.
Okay. Well, thank you very much for joining us. I have more questions for you, so hopefully, please stick around for a couple more minutes. When we're talking about female athletes, we have many here at University Health, including Paige. And remember, if you're a reporter, email us your questions at publicrelations@uhkc.org and be part of our conversation this morning.
For early appointments and late night care, for the moment you find out it's a girl to the first time you hold her hand. With advanced maternity care, on-site Level 3 NICU, and access to Level 4 NICU, University Health is the one for you. At University Health, we're teaching Kansas City what it means to care. Through the power of academic medicine, teaching can bring more minds to our patients. It solves some of the most complex medical cases in the city. And it provides hope to those who need it most. How can we care for all of Kansas City? Teaching can. University Health.
Thousands of soccer fans poured into Kansas City Stadium this weekend to watch Ecuador take on Curacao. In that sea of fans was a very excited University Health physical therapist named Paige Valaika. You just met her a moment ago. Leslie Cardo is with Paige this morning, and they join us from our Lakewood campus live. Leslie, good morning.
Good morning, Keith. Good morning, Keith, and Healthy Goal fans. That's right. I am live with Paige Valaika. She has a doctorate in physical therapy, and on her way to earn that, she played for Rockhurst. She played soccer, Go Hawks, and she was at the game. Paige, you left early and you took the bus to get there. Talk to me about that experience.
So we were a little nervous after Tuesday night craziness, apparently, with the buses, but they did make some changes. They started buses a half hour earlier, and then they apparently had more buses, which I would agree there was a lot. So at least when we were there, we did get there early. Like we got there right when the buses started. So if you're going, I don't think if you do that, I think you will honestly be fine. We didn't wait at all, really. We showed up right when they started, got there plenty early. We also got there, we pretty much left right after the game, but again, we didn't wait. For us, our experience, the buses were smooth. I'll be really interested to see how it goes for Thursday's game, again, back like on a weekday. So we'll see what happens, but buses for us were fine.
The only snafu, if there was one, was bottled water. And this is a really interesting point, you guys, if you're going. So FanFest, empty bottle. Game, tell me what happened.
Okay, so I was FanFest. I did FanFest Friday, game Saturday. FanFest like can just be any plastic bottle. If it's empty, you can bring it in. When I was getting on the buses, though, I had my empty plastic bottle, and they said how to get rid of it because it was not sealed. So if you get like your gas station water bottle or something like that, keep it sealed.
Excellent. Do not open. The enthusiasm at Arrowhead was
Amazing. Like Arrowhead, obviously amazing already, but then when you bring like that World Cup energy and the fan bases and just like the intensity of that and just the global scale of that made it 10 times better.
awesome. And I know what you guys are wondering. Did she see the king and queen? She did not. Unfortunately, she didn't. She did not.
I was sitting probably like right across from like where they're probably in those like nice like glass boxes. They were in one of those probably. So
It was awesome though.
amazing. Yeah, just to see that global stage. As like a longtime soccer fan, it's like one of those bucket list things, but like the energy the whole time. It was a pretty intense game. So like you didn't want to leave your seat because you were like, I'm gonna miss something.
Paige, one of the things we talked about is there is so much excitement about World Cup, right? And as a young girl and then a woman athlete, you are hoping that that enthusiasm translates to next year as well, correct?
Yes. So next year, for everyone, in case you didn't know, next year is the Women's World Cup. It won't be here, like in our country or North America. It's going to be in Brazil. So obviously, it's going to be a little bit different right now. I know some of the excitement is we're a host city, and it's coming to our country and things like that. But I do hope FIFA and the fan bases have the same excitement for the girls next year.
Absolutely. Because as a young girl, did you watch these games growing up?
Yes, like I mean, I watched men's and women's, but it was always a little bit. There was always more hype for the guys.
Sure, yeah.
So I hope the girls get same hype next year.
Remember that, soccer fans or football fans, for our international fans. Okay, last one, Paige. You were in excellent shape, and you went to FanFest, and then you went to the game. But even you admit you were a little sore after all that walking.
Yes.
The urge you said was to sit on the couch the next day, but you knew better. Tell me, for those of us who are much more sore than you would be, give me some tips to just get rid of that.
Yeah, so like obviously I'm on my feet a lot here, but then Friday Fan Fest, Saturday game, even yesterday I was like, oh, like my feet are kind of hurt. I'm a little bit like sore. Again, do not just sit on the couch. The best thing you can do, honestly, is get up. You got to move at least a little bit, because actually just sitting on the couch staying still can actually make your soreness feel worse or last longer. So gentle movement, do a little bit of stretching, go for a light walk, do something, probably actually feel a lot better afterwards.
And it's not super hot out, so it'll be better.
Yes. Yeah. If you can beat the heat, take advantage, especially of today. I think it's going to be nice.
Paige, thank you for sharing. Thank you for sharing about your awesome career and what you do now. We really appreciate it.
Thank you for having me.
All right. Thanks. Reporting live from Lakewood with Paige Valaika, Leslie Cardo for Healthy Goals.
All right, Leslie, thank you so much. And Paige, thank you for your time this morning. Well, as we get older, simple tasks like doing yard work, picking up weights at the gym, or putting that suitcase into the overhead bin can become a lot harder to do. This morning, University Health orthopedic surgeon Dr. Nathan Goss explains how strength training can help each of us avoid illness and injury as we age.
Okay, I fell totally in love with the barbell. Lifting heavy, it's a high for me. It doesn't, it's not intimidating, doesn't scare me. I'm not afraid to fail. I failed a few times, but I've also got some big numbers, and I'm proud of that.
Meet Montoya Collins.
Yeah.
At 53 years old, she loves to break a sweat. Her goal, besides getting pumped, is avoiding the doctor's office.
I don't want to become another number. I don't want to be labeled with any chronic illness. I want to stay here to keep healthy, to look good too. But the bigger benefit to me is being healthy on the inside.
Hi.
I'm Leah Gauze. I'm a physician assistant at University Health Orthopedics.
Hey, and I'm Dr. Nathan Gauze. I'm an orthopedic surgeon at University Health, and we're here to talk about strength training today.
Dr. Nathan Gauze and his wife Leah teach their patients about the importance of strength training, especially as we age.
Strength training is very important to keep your bone density strong as you age, to prevent osteoporosis and fractures.
By keeping your muscles strong, it challenges your bones on a daily basis, which is a good thing. Helps to keep you from getting fractures that you might otherwise get if you were to have a simple fall.
For example,
So I went all the way down. I never told you this. I went all the way down on the steps. And I caught myself, and I thought to myself, if I didn't have upper body strength, I could have hit my face, I could have injured myself, I could have fractured something.
to review, strengthening muscles keeps bones strong, can prevent serious injuries from falls, and, says Dr. Gauze, protects your joints like your hips, knees, and shoulders. One more thing, they say stretching is just as valuable.
As we age, we dehydrate, right? And so our tissue becomes what's called desiccated over time. And when you lose that hydration, your tissue doesn't stretch as much. And I would say the bulk of the folks that we see in the office are a result of them being tight.
Yeah.
Whether it's their hamstrings, whether it's their calves, and that's where they get these chronic injuries, these issues with their joints. It's important to strengthen and lengthen is what I like to say.
All right.
About a decade ago, Montoya discovered CrossFit, a brand of workouts that focuses on strength training, cardio, and functional movement, which her coach and owner of Fountain City Fitness prioritizes.
But in all reality, I want to make sure that for the life of you, when you go and travel, you can put your suitcase in the overhead bin. So yeah, that is our number one goal, is to make sure that they can live a better life.
Montoya says this is the strongest she's ever been, and she's using that strength to live her best life.
Living healthy, just living well, fills my cup. Did you get that?
All the World Cup events and those big crowds. That combination can be a lot of fun, but for some people, crowds can be intimidating. Up next, tips to help you manage crowd anxiety. Also, we'll ask our experts more questions. If you have a question for our doctors, we want to hear from you. Email us them at publicrelations@uhkc.org. Again, publicrelations@uhkc.org.
For early appointments and late night care, for the moment you find out it's a girl to the first time you hold her hand. With advanced maternity care, on-site level 3 NICU, and access to level 4 NICU, University Health is the one for you. At University Health, we're teaching Kansas City what it means to care. Through the power of academic medicine, teaching can keep providers one step ahead of clinical advancements. It puts innovations into practice, and it helps write the next chapter in medicine. How can we care for all of Kansas City? Teaching can. University Health.
Do big crowds make you nervous? Does your heart rate increase when you're shoulder to shoulder with strangers? Or do you avoid going to events because of the crowd size? If so, you're not alone. University Health Clinical Social Worker Sarah Kaiser this morning with some helpful tips on managing crowd anxiety to help you still enjoy all the World Cup fun.
Some people fear for their safety just because we have had a lot of events happen in our world, and so that can be part of it.
Clinical social worker Sarah Kaiser, speaking to Fox 4 News Afternoon Drive webcast, offers smart tips on ways to reduce anxiety in large crowds.
It is important to kind of prepare yourself emotionally, be aware of your own anxiety. Are you one that gets panicked in crowds, or do you just get a little nervous and you want to stay with your friends? If your heart rate is increasing when you're in crowds, like it really is increasing, and you're getting uncomfortable, you're starting to sweat, the World Cup ain't the time to test that out.
If you have concerns over big crowds, Kaiser suggests start off small.
You have a significant other that is like, I want to go and I want to go together. Make a plan together. Maybe don't go to the biggest watch party or the biggest event, but go to one that is maybe closer to home that you're familiar with. Go to a festival on the weekend. And see how it goes for you. Have you wanted to go, or have you been avoiding events that have been happening in the city? Figure out why that is and make a plan for yourself. This is something that's impacting you a lot. Talk to your doctor and see if they can find ways to help you too.
And if you go with a group, plan ahead.
And I would ask everybody in the family, what are you afraid might happen? And then make a plan for each one of those things. Meeting points that we all met up at a certain time. Make sure everybody has a watch on as well so you can watch the time. Your phone numbers, maybe stick those in your pocket so if your phone dies or you don't have cell phone service, that you have the phone numbers of your loved ones that you can still get a hold of.
Okay, everyone, let's bring in our experts one more time, Dr. Mark Steele and Dr. Christopher Shaw. Gentlemen, Dr. Steele, let me start with you. A couple more questions. This one comes from Caitlin Canute with KSHB Channel 41. How does humidity impact athletes, whether it's kids playing t-ball or elite athletes?
Yeah, so as I mentioned earlier, the primary way that the body dissipates heat is through sweating, and that sweat then evaporates into the atmosphere, which is part of the cooling process. But if there's a high degree of humidity in the air, that becomes less efficient, and so people can potentially overheat easier, and if the humidity is high.
Okay. And Dr. Shaw, I want to ask you one more question from Caitlin over at Channel 41. When you see athletes giving it their all on the global stage in these matches, how long does it really take for their bodies to recover before they play another match?
At this level, these elite athletes, they spend 4 years preparing for this. So they do recover more quickly than the normal person. But you'll see, especially as we get later in the tournament, there will be longer duration between matches because it does take them several days to a week or more to be totally match ready for the next game.
What can parents take away from this? In other words, how long should they allow their kids to recover from soccer matches or any type of athletic activity that they may be taking part in?
A lot of that is age specific. So the littler kids, they bounce back real quickly, but also their games are not as taxing versus when you're getting up to like mid to late teen years. Those games get more similar to a very competitive match, and it may take a day or more. So at the high school level, they're not going to play probably more than 1 to 2 matches a week unless it's in a tournament scenario, and that's very taxing for those kids. And
Mhm.
we need to recognize that they are athletes and that they need to do, like Paige said, an active recovery where they're stretching and staying moving while they're allowing their bodies to recover.
Yeah. Good advice for all of us to get out there and just keep moving. All right, Dr. Steele, Dr. Shaw, thank you both for being here this morning. That wraps up this episode of Healthy Goals, where our doctors talk about all things soccer. Once again, thank you, Dr. Steele, Dr. Shaw, and also Paige out at out at University Health Lakewood. Be sure to join us here again Friday morning at 8 o'clock when we talk about Thursday night's match, the Netherlands versus Tunisia. And finally, don't forget to hit that like button and subscribe to University Health's YouTube channel. From all of us here at University Health, we hope your day is full of big saves, great goals, and plenty of cheers. Have a great day.